And we are live. I'm Marcia, and I'm here with Dr. Yaker today, and we're going to talk hair loss and hair growth. So you guys know my story. I had COVID not once, but twice, and my horrible side effect was losing my hair a couple months after having COVID. So had I not been on that journey of COVID, I wouldn't be here today, but I wanted to share my story because I didn't want to suffer alone. So when this was happening to me, being a person who had super long, thick hair and me losing my hair, it was very defeating. And I was trying products on the market like Nutrafol. There's a bunch of different products I tried. I tried like the Monat shampoo and conditioner. Vegamore was another one. So these are products I tried for over a year, maybe almost 2 years, because I was 2 years, like I had COVID 2020 and 2021. So by the time 2022 came around, I was like, I need some help. So at the end of 2021, I actually saw Dr. Yaker. What happened was, it's because of you guys, I said, you know what, I'm frustrated, I'm losing my hair, I need some help. And you guys said, hey, I've got some tips, and a couple people suggested you.
That's very nice of y'all. Thank you very much.
Yes, and you were locally. So Dr. Yaker's in the DFW area, he's in the Plano area. But even if you don't live in state, he does telemedicine. So it's the beauty about today's day and age.
That's exactly right. COVID proved that.
Yes, it is. Yeah. So here we are. It's, you know, hair restoration, and we're talking about hair loss and hair restoration today. And so you guys know my story on this, and a lot of you had questions. You wrote in. It was a lot about hair loss, about COVID. Why do we lose our hair with COVID? And then menopause. And of course, obviously I'm getting that age. I'll be 48 next week. So I'm like, oh my gosh, is that time already? But I just want to share you the journey of my story and then what I learned from Dr. Yaker, because he's just a wealth of knowledge. And had I not been to him for a couple sessions, I would have haven't known this, because you guys asked me questions online. So let's begin with today's questions. Okay, first off, why do people lose their hair with COVID?
Sure. So when we take a step back and we talk about the different causes of hair loss, there are several. The most common for both men and women is still going to be genetics.
Okay.
So for men, it's as much as 97, 98% of the time. And with women, it's about 50% of the time. So that is always still going to be your most common cause. The second most common cause of hair loss is this telogen effluvium that's hard to pronounce. So the basic understanding of that is your hairs are in different cycles. And when more hairs that are in the active growing phase gets thrown into the resting shedding phase, we get massive exodus of hair, and that's your telogen effluvium. So telogen effluvium is essentially a stress-induced form of hair loss. So when we have COVID, we are stressed. So hospitalizations, high fevers, other chronic or acute medical conditions, things like that, which COVID is stressing your body. And so your body is responding by throwing these hairs into the telogen phase. That's where telogen effluvium comes from. So, but the good news is when it is telogen effluvium, it's generally going to last for a short period. There is a level of chronic telogen effluvium. It's rarer, but it can happen. But typically with COVID, you're going to have this phase. It can last for several months, and then your hairs will recover. So the seeds that are down below underneath the skin actually haven't died out. They haven't gone to sleep, and they're rebuilding you a brand new flower, but it does take time. So telogen effluvium is very similar in postpartum hair loss. Menopause can cause it. Other hormonal changes can cause it. So when we get into the weeds about menopause, I'll be able to explain a little bit better.
Okay, So with that being said, that leads to my next question. What are the different types of hair loss with women? So still you're going to have your genetics. So I have a picture in my presentation. It's a bucket, and a bucket has a lot of holes. And genetics is still going to be number one, because it's going to be 50% of the time. And then the other holes we have to try to plug up. So what I mean by that is, even if it is genetics, you still may have some external factors that are accelerating your problem. So let's start with genetics. People think that if your mother's father doesn't have hair loss, you're out of the woods. That is a complete myth. Everybody comes to the office thinking that it has to be your maternal grandfather. That's not true. Yeah, we've heard that.
Right. So the way I try to describe it is that hair loss can happen from either gender. It can skip generations. And because we're not clones of our ancestors, your story can be different. So the year it starts, the location, the severity, and how fast you get there could be unique to you. So we'll oftentimes get a lot of people in here that say, well, I don't have anyone that looks like Larry David or Danny DeVito. It can't be genetics. Well, all you need is a little bit, and you could actually be worse than that person. So that's a very important factor to understand. Then we have to talk about other things, age, right?
Yep.
So hair is an organ. There's wear and tear factors, no different than our knees or other joints. So that's one factor, and that plays a little bit into the menopause as well. Then you have to look at nutrition. We are what we eat. 97% of our hair is made of protein, specifically keratin, which are specific amino acids. So if we are not good protein eaters, which unfortunately a lot of women don't get enough protein, you're not providing enough strength to your hair. So that's a very important factor. But other nutritional things will be people who have eating disorders. If you're hospitalized and you're not eating right, or you have a tube down your throat, so you're not getting good nutrition, those can all affect it. And that's where that stress-induced hair loss comes from. Other factors will be hormones. So when women are taking testosterone will make a couple of hormones, but one of them is called DHT. So when your testosterone goes up, that factory makes more DHT, and that speeds up your hair loss. So whenever women are considering testosterone, please know that one of the most common side effects is it can be hair loss. The severity is going to be up to you. There's no way to predict that.
Right.
But very commonly, women will be on testosterone for a while and not really understand why they're losing their hair. And I've seen women have a significant amount of hair loss, and also even have the male pattern hair loss where they have the receding hairline. I call it the two-car garage,
Right.
or even the crown loss, and it'll present like a male. Why? Because they had the male pattern hair loss gene from an ancestor, and DHT is what activates it.
Right.
And now they're taking testosterone, more T makes more DHT, and it speeds it along. So that's a very, very common cause of hair loss.
So you wouldn't know that unless you took testosterone, then you would find that out.
Very, very commonly is usually when someone realizes that they had a problem. Having said that,
right,
because male and female pattern hair loss, genetic hair loss, is going to be unique to you,
right.
You always had it. It may not have shown its ugly head yet, or it had been very, very subtle. And now you took testosterone, and now it put it into full force.
Okay, makes sense.
Yeah.
So like with menopause, like
Uh-huh.
what I thought was interesting when I came to you, you said by the time someone comes to me, they could be like 55 or 60 and they've lost a lot of hair.
Yes.
Sometimes it's too late, like to regrow that.
So yes, and let me talk about menopause real quick.
Yeah.
So the reason for why we see hair loss with menopause is because, again, there's a specific ratio of hormones that men and women make. And women will make more estrogen than testosterone.
Right.
So as women start to get perimenopausal and get into menopause, their estrogen levels drop. We're adjusting that ratio of testosterone to estrogen, and that adjustment creates this hair loss pattern, because now there's this testosterone here, and it may have also fluctuated, but really more it's the estrogen that has dropped.
Okay.
So estrogen does 300 positive benefits for a woman, one of which keeps the hair nice, full, and supple. So now we're dropping it, the hair gets dry and brittle, because the testosterone can make your hair dry and brittle. And we start to see some hair problems from that. So hormones is still going to be your stress-induced issue, but it also can affect genetics, because it just starts to speed things along. So it's quite complex. It's not as easy or black and white as typically with men. It's, hey, they've got a two-car garage, or they're losing their hair. It's genetics.
Right.
But generally speaking, with women, we do try to throw the kitchen sink at them and get some lab work, and they've already had lab work, things like that. So I really try to evaluate it from a bigger picture, whereas with men, it's generally easy. And factors that we're not going to discuss in this visit today is certain autoimmune diseases. Those are things that if I do feel that a patient has that, I do refer them to the dermatologist. So everyone comes and says, what is alopecia? Alopecia is just a medical term for hair loss.
Okay.
Genetic hair loss is called androgenetic alopecia. But when people have those circular patchy areas of loss or complete hair loss, that is an autoimmune one. That's called alopecia areata, or alopecia universalis, or alopecia totalis. Those are different forms of alopecia. But alopecia, folks, is just a fancy word for hair loss. And then there's several subcategories of alopecia. So what we treat is your telogen effluvium, and we treat your androgenetic alopecia.
Okay, so there are non-surgical hair loss solutions. Say you've got COVID and you lose your hair, or maybe it's menopause. So what are some non-surgical solutions?
Sure. So when it comes to shampoos, conditioners, and supplements, if those work, I wouldn't be in practice, right? I'd have to go find a new career. So let's think logically at how that plays out.
Okay.
If you wash your hair and it's being removed in 30 seconds to a minute, how is it going to get in and actually function, right? So if it's genetics, it's all based on certain internal factors. That's why we actually need FDA-approved medication, right? When it comes to a shampoo, I like for people to understand that the reason why we use a shampoo is not for our hair, it's for our scalp. You wouldn't say you're washing your eyebrows. I don't say I'm washing my beard.
Right.
We're washing our face.
Right.
So scalp, face, and body is all one sleeve. It's skin. In a 24-hour period, it develops dirt, oil, sweat, debris, hair products, right? And then we go to the gym. And if ladies are only washing their hair once or twice a week, and with the Texas heat and the gym and all these dry shampoos, you're essentially letting makeup take up on your scalp, and it's plugging your pores. So if I put a microscope on your head, which we've done before, right?
Yes,
you will see all the buildup. So ladies won't go to bed without washing their face to remove their makeup. You are allowing all this makeup to build. And then in addition to that, our skin sloughs every day, debris, dirt, things like that. So we are not washing our hair. I wish I could change that terminology. We are washing our scalp. So the more you wash, the better off you will be from a hygienic and health standpoint. Now, is it easy for a lot of women to wash? No, and I understand that. But if we're talking principles of hair washing, don't let anyone tell you that hair washing is bad for you. What are the two myths? Washing my hair makes me remove all my natural oils. That's absolutely false, because when we wash our face in the morning, we're removing the oily skin. And then what happens at the end of the day? We're oily again. Our body will always make more oil once we sweep it away. So it's no different. So that's a very, very old myth that's carried, 40, 50 years, that washing every day is going to strip your hair of its natural oils. The second thing is I'm washing my hair, I'm losing my hair, it's my fault. Absolutely not. So we lose anywhere from 50 to 100 hairs a day. So if I only wash my hair once a week, seeing 700 hairs in my hand, and women generally have longer hair, it coils up and it looks like a cat fur ball, right? So it's always going to look worse the longer hair we have. So the more you wash, the less shedding you'll see. But why is it that we shed every day? Because our hair shaft, which is above the skin, which we care about, only lives for a couple of years, 2 to 6 years. And the seed, which is growing that hair shaft, knows when its time is up. And when its time is up, it pushes it out and grows a new one. So we are actually helping those hairs that are unattached come out when we ruffle our hair in the shower. We're not pulling it out. So then people say, well, why am I seeing a white tip? That's the seed. Seeds are always black. It doesn't matter what race or gender you are, seeds are always black. So, or they'll get a little bit of a lighter color. But that white bulb is the telogen hair, which is the shedding hair, which is supposed to leave. So we're not taught this in school. So the assumption is I just pulled all my hair out. I need to stop washing. And then when I do wash once a week, now I have 700 hairs in my hands. So more frequent washing is not only hygienic, but it's important for our hair cycles.
Yeah, I mean, I actually learned that too, because I had no idea that your scalp is an extension of your face. You don't think of it that way. You think of it as separate entities, right? It makes so much sense. And you guys have seen, I have had on my reels that I have my before and after picture, and it is really gross, because I was washing my hair maybe 2 or 3 times a week. And it looks, oh my gosh, it looked like it was another world in there. And it was actually, it looked dull. There was, I want to say fungus among us. Well, you were saying that.
We do see that.
You do, yeah. And then within months after using a couple of those products, we'll talk about that. My scalp was very shiny. My hair was shinier and it was thicker. So like just the before and after, that completely changed my world. And you guys, now I just like do my hair either every day or every other day. And it sounds like a pain in the butt, but actually my hair is better now, which is crazy.
It's all about maintenance. If you care enough about being healthy and keeping your hairs strong, you have to just do it. I always say that your hair, your skin, your teeth, and your physique always want to get the best from us. And as we get older, it wants to get away from us. So we have to maintain, and the only way we can maintain is by working hard every day. And that's the same thing with our skin. It is obviously easier to wash our skin, but washing morning and night, you're just going to see a difference. You will.
Exactly. And then my before and after the 9 months, you could see like my part grew in. It just was a shinier scalp, shinier, thicker at the root. it just even the hair difference, I thought was so amazing. Because you have that awesome camera that shows up there.
You don't find it awesome when you first see it. It's on the after.
On the after picture.
Yeah, the after picture where it looks awesome.
You don't like it on the before
That's right.
picture. I was all really gross. I just thought, oh my gosh, it felt like I looked like a minion. And I had a couple of hairs. I was like, what is going on?
Yeah, if there's a hair, there's a chance. That's how that philosophy is with medicines, which we'll talk about. So now that we've talked about shampooing, conditioning is very simple. Think of it as a skin moisturizer. After you wash your face, you want a skin moisturizer. That's just for the ends. You don't have to put that on your scalp if you don't want to, but that's more for the hair. Hair, though, is dead. It doesn't hurt. It doesn't bleed. It's what we spend money on. The only thing that's alive is that seed that's underneath. So now when we talk about supplements, you try to bevy of them. These companies that are out there, and no knock on them in particular, but they spend a lot of money on marketing and they really can hit the right buttons. When we are aggressively looking for something that bothers us, we are sometimes going to bypass logic and just say, I'm just going to consume all this and see what's going to work.
Correct.
But if vitamins was the only solution to hair loss, again, I would have to find a new career.
Right.
So while nutritional deficiency that we talked about earlier also involves vitamin and mineral deficiencies, there's no doubt that if you are low in certain minerals and vitamins, iron, things like that, that will certainly affect your hair loss, and that can be another telogen effluvium effect. But when people come to my office, they've generally tried all those things like yourself, and they've spent a lot of money. And some of these companies, they're $80 to $88 just for 1 month's supply. And we are not taught how to read labels in school. So if you were to actually turn it around and read it, it's a watered down multivitamin with just some really good marketing material on the back. So what I tell people is this: keep things simple. We know what a shampoo and conditioner is now. How do we feed it? You need two things. You need good quality vitamins for nourishment, but anybody's going to tell you that it's not just for your hair, from hair to toe, but you need protein. The Menoplex supplement that we make is essentially keratin, and 97% of our hair is keratin. So how do we get muscle to the hair to keep it strong? You got to take protein, both with food and also this supplement. A multivitamin will provide the right nutrients, and then now we're going to clean the hair and the skin with our shampoo and conditioner. So that's how we keep things healthy and strong. And then when we talk about non-surgical solutions, that's what we're talking about, the seeds themselves.
What about biotin? Because that's a big one.
So biotin is also a very big myth, just like hats cause hair loss, right? So there is very, very little, if anything, no research behind biotin with hair loss. If you are biotin deficient, it may cause some hair loss or hair thinning, but there's a bevy of other symptoms that it would cause: rashes all over the body, some oral ulcers, amongst other things. But there is a very low chance, less than 2% chance, that you have a significant biotin deficiency. There is a study that showed that some women who had hair loss, they told them that they did have a little bit of a biotin deficiency, but it was very low. We actually get biotin from healthy foods like salmon, other proteins, good quality fats, and green vegetables. But biotin is actually vitamin B7. So to the lay person, when they hear the word biotin, they're not told that it's also in your multivitamin. It's vitamin B7. So as long as you take a good quality multivitamin, and as long as you're alive on this earth and you're eating, you're getting enough biotin. Now, if you still have a concern, go get a nutrient panel and see if you're a little bit low. But that's not the reason why we're sitting here today with your hair loss. It's not biotin deficiency. And don't start overdosing, because you can actually get a toxicity effect. And there's symptoms that surround toxicity.
When I took biotin, I broke out. I broke out really bad. I had bad acne. And a girlfriend had told me, said, it's probably because you're taking biotin. And I had no idea. I normally have oily skin. And I was like, what is making me break out? So that was a common effect.
Save your money on those things. Keep it simple. It's very simple. Nutrients require the vitamins, minerals, and proteins. That's all you really need from a supplement standpoint.
So when he's talking about shampoo and conditioner, so he actually has this volumizing shampoo and conditioner. And what I do is, in the beginning, I did it every other wash, just because, it was kind of really cleansing the hair. And it felt different. It just felt like more squeaky clean. Because, your normal shampoo, conditioner, whatever that is, whatever brand you use, sometimes it has all these silicone things or fillers, and it feels a little shiny, right? It just feels differently, like silky. And then when you have this on, it feels a little different, but it's actually cleaning your scalp. Is actually by the root. You're not having any kind of product or buildup or oils.
Yeah, you know, these expensive brands, while they look good and they smell good,
Yep.
the purpose behind them is not to help your hair problem or
Right.
keep your hair hygienic and strong, right? So there's so many ingredients on these shampoo bottles that you can't even pronounce. They have 4 or more syllables, right? So we don't know what's really the purpose of them. So we went back to, again, keeping things simple. Let's talk about the face. We want a low pH ingredient, right? Our gut wants to be elevated, but we want to create an acidic environment for the skin so that the acid mantle, which is our defender, is repaired. But also by doing that, by lowering the pH on our hair, it actually allows moisture to get back into your hair follicle. So you're actually giving yourself more volume, more bounce, because now the hair has more hydration into it. Just the other thing is glycolic acid is a really good skin cleanser.
Yes.
So these other companies that are out there are not putting strong enough skin cleansers to actually sweep away that dirt, oil, sweat, debris, and hair products. So we need something stronger to sweep it away. So we'll have several people coming in that are on expensive products. They'll be my first patient in the morning. I put that microscope on and they say, I just washed my hair 30 minutes ago.
Yes.
It's because there's not enough ingredients to actually sweep it away. And the same goes for organics. Organics and tea tree shampoos, those are not meant to be cleansers. They're meant to help people who may have some sensitivity to products and ingredients. So we'll never see really good quality cleaning from those kind of ingredients.
I have to say this, I was blown away because I washed and shampooed my hair that day.
Yeah.
For my
You saw that microscope photo? Yeah. That'll scare you straight.
Yes. And then you put that on my scalp and I was like, oh my God, y'all, is scary. And you'll have to go to my Instagram or TikTok to see it. It is really disgusting, actually. But you do like the after. It really is kind of crazy.
Yeah.
I mean, I do have glycolic, I would say, cleansers for my face, so it does make sense you would have glycolic in your shampoo.
It's the same skin.
Yeah.
It's just a little bit higher up. That's it.
And I love glycolic cleansers because your face looks clear and, it's very clean looking.
Right.
Has a nice shine. Well, same with goes for the scalp. It's literally the same thing. It's so crazy.
That's right.
So, and I was taking your Menoplex, you're talking about that. I took this in the morning and at night. So I usually took it with breakfast and I took it with dinner.
That's right.
So, and then what is the Menoplex made out of?
That is what I was explaining about the protein.
Yes.
So 97% of our hair is keratin based, and this is a keratin supplement.
Okay.
This is not a vitamin; it is actual protein.
Exactly.
So think of it as a protein shake for your hair. We've got to give it good
like
quality protein so that it can grow strong.
Protein shake for your hair.
That's right. So any of these claims from shampoos and conditioners that are making claims that they're going to regrow or rethicken your hair is not reality. A lot of these companies will just put in compounds like even salt, because what follows salt? Water. Right. So Thanksgiving, you need to wear jogging pants because you're so swollen. That's what they're doing. You're not getting a physiologic rethickening of your hair with shampoo. It's just certain components or ingredients are helping to swell it up.
Interesting.
Yeah.
Okay.
Yeah,
That's
so it's more synthetic than reality.
Okay, so let's talk about Hair Lab number 2.
Okay.
This is my favorite product, and this is like the product.
This is the Cadillac of products. Yes.
So tell us about Hair Lab number 2.
Sure. So when it comes to treatments for hair, we cannot bring back bald hair yet. If that was the case, I'd be vacationing with Jeff Bezos. I'd be his hair guru, right? So if we are completely bald, we're shiny, those seeds are likely dormant, and that is going to require a hair transplant if you're a candidate.
Gotcha.
But when we still have hair, whether it's visible to the naked eye or with my microscope, that means there is still a chance to be able to rebound and improve it. So think of hair medications that are prescription more like a toothbrush. It's mainly there to prevent more damage, more problems. And I know that's not what people want to hear, because we want to pay for something to get better. But imagine if you're still in your 3rd, 4th, or 5th decade, or even 6th decade, and you want to live to be 100, it's going to actually keep going. Your hair problem is going to keep going, where your hair will not outlive you. So if we can at least build a dam to prevent more hair from spilling over and stop it in its tracks, that's still a win. But can we get better? Absolutely. There's a 70 to 75% chance that this medicine can actually rebuild. I don't like to use the word regrow, because that makes you think that a bald area is going to regrow.
Right.
But let's talk about making it taller and thicker and stronger.
Right.
And that's what we've proven. So when I use the microscope, I'm not just trying to gross you out with your scalp. I'm actually trying to see if there's some hairs left, because a lot of times we just can't even see them.
Right.
Yeah.
So this hair lab number 2, it has minoxidil, finasteride. I go through the ingredients.
Sure.
I actually learned through this. I thought, when I was losing my hair, someone's like, you're going to have to get some Rogaine.
Sure.
So I immediately ran out to, I don't know, like CVS, got some women's Rogaine, had the foam stuff, sprayed it. And you guys, I did not like the foam stuff. I'll just be honest. I was just trying to,
It's messy.
it was messy. I was trying to trudge through. It was super sticky.
Yep.
And you have to put it in the creases everywhere. And it would just like, the next day you try to style your hair, you just had to wash your hair all over again. So this was actually drops, and it looks like water drops. And you put like 20 down the part, 20 in the crown area. So you actually have 20, 20, 20, 60 drops a night. It takes like 2 minutes to kind of, massage it in. You wash your hands, you're done. But I learned about these ingredients from you, so tell us about it.
Yeah, sure. So the most common ingredient for male pattern hair loss or medication is called Propecia or Finasteride. It's been around since the 90s, but minoxidil for hair has been around since the 80s.
Right.
So the difference between the two is, let's bring back that DHT hormone.
Right.
DHT is only lowered by the use of finasteride. So what finasteride or Propecia does is it asks testosterone to stop producing as much DHT. There's a common misconception that it lowers your testosterone. It doesn't. It just lowers the DHT part.
Okay.
The problem is when people become internet doctors, they go and they read about these horrific side effects with oral finasteride. So there's a very low chance that it can affect your sex drive, your erection firmness, or the quality or the quantity of your sperm volume. It's still very low risk, but we wanted to try to lower it even further. So with a topical formulation, by rubbing it in, it's not really getting in systemic. So we just don't see those side effects. It's possible, but it's just something that's going to be very, very low risk.
Right.
About 30% of our patients are already on other meds. Some include people that may have had a side effect and they're not having that problem with the topical. The reason why we also went topical is for women. Women can take the oral finasteride. They don't really see the sexual side effects, but I don't feel like statistically it's as effective in women as it is in men. But when we moved to the topical, we saw it very, very different. So when it comes to minoxidil, what that does is it has no effect on DHT. So when people go straight to the grocery store to buy that and they bypass the true medicine, they don't know why it's not working. So what minoxidil does, to keep it simple, is it's theorized that it helps to open up your blood vessels. That's going to allow your nutrient uptake, your blood flow and oxygen to improve. Tries to keep your hair in the growth phase longer. So when you combine finasteride with minoxidil, that's that 1-2 punch. It's got a huge synergistic effect. So after we applied that, I wanted to do some research to find what are some additives that will play nice in the sandbox with finasteride and minoxidil, enhance penetration, and improve blood flow. So we added a low-dose steroid that improves the inflammatory effect because we know it's there. We added azelaic acid that also helps as an antioxidant, but also helps with anti-inflammatory effect. And then we added retinoic acid. Some people call it tretinoin or retin-A.
Yep.
And what that does is it's actually been proven to help the molecules of minoxidil to penetrate the seed much better. It also is, as you know, an exfoliator.
Yes.
So by continuing to exfoliate, that's actually helping the process as well. So adding all of these ingredients all at once, you're not only are they playing well together, you're not going to notice any clumpiness. There's some other companies that have tried to do something similar, and the biggest concern that I have is the consistency. If people don't like the consistency like you did with the foam, they're not going to be compliant.
Right.
So we have to be able to come up with something because it's technically still medicine.
Yeah.
It's not as bad as when you were a kid and you drank that liquid antibiotic, but it is still medicine. It's not it's not a hair product, so we can't make it perfect in terms of it trying to feel like a hairspray or a gel.
Right.
But we've done the best we can with it still being technically a medicine.
No, I think this is like let me tell you guys, this is the wonder stuff. It's like fertilizing the lawn.
That's right. It's a fertilizer.
It is.
Yeah.
It's just, it is amazing.
Thanks.
So yeah, and of course, my hair fell out in different cycles, so and it's still like growing back. So I feel like put hairspray and gel because it's all grown out in different cycles. But it's actually pretty cool because using that, I was able to see it faster. Like within 10 weeks, I had came up for a consultation, and we ended up doing my after picture just to kind of see, because when you live in your body every day, you're like, oh my God, my hair's not growing.
That's right. You see it every day.
See it every day. It's like watching grass grow. You're not going to see it grow. But with the pictures, I actually saw my baby hair was growing back, and then my part was getting thicker. And what was interesting, this is another thing I want to talk about. My hair is getting darker. It was a darker color. So why is that?
So the reason why is when this DHT hormone is attacking, it helps to rid that hair of its good blood supply, nutrient support, etc. And also adding in the minoxidil is going to also improve that.
Okay.
So by lowering the DHT, the hairs are healthy and happy. They have their normal production of the nutrient uptake, blood flow, and oxygen. Now we're adding minoxidil to open up the blood vessels to further improve that. That's why that synergy is so amazing. So we are seeing people get a more robust color.
Yeah.
It happens about 40 to 50% of the time.
Yeah, because I have like a light brown, dark blonde
Yeah.
hair. It's kind of like that, do they say dirty blonde?
Yeah, I used to have dirty blonde. And when I got on it in March
Yeah.
of 2020, I didn't see people for a year and everyone's like, did you color your hair? It just got darker. It just got fuller.
Yeah.
Yeah.
Yeah, I mean, he has gray hair, so.
Well, you won't trust me if I lose mine. So I got to work harder than you to keep mine.
That's too funny. I literally said to him, I go, do you use your products too? Like, I just want to know. He's like, of
Yes.
course I do.
I'm a guinea pig, obviously.
I would hope so. But yeah, it's kind of funny. You use gray hair for sure.
Thank you.
But I noticed my hair was getting darker. And even my hair guy who has been using the same color was like, you're not having the same color blonde that you used to.
Yeah.
And we've been working together for a year, obviously. Well, my hairdresser and I for years, but us for almost 9 months, 10 months.
Yeah.
And so just to kind of see that change. So it's not that it's major. I mean, I don't mind the color difference. It is a little more robust, but hey, I think it's all good. But yeah, my hair is growing, so that's a win.
That's exactly right. That's exactly right. You have hair to color, so that's important too.
Yes, I do have hair to color, and that's another win.
That's right.
So yes, when I heard about you through a client, because obviously a couple of clients, everybody, this is kind of a funny story. A lot of people, I'm like, hey guys, I'm trying hair log number 2. I'm obviously spread the message for the women that's lost their hair via COVID or menopause, and they want to keep it. A lot of people, Dr. Yaker, you're pretty famous for hair log number 2. And I was at another doctor's appointment recently, and we were sitting there having a chat by his desk, and he had this on his desk. I was
When
cracking
you
up.
texted me that, I was dying laughing. That was hilarious.
Oh, I'm like, we got to take a picture.
That was hilarious.
I was like, we got to take a picture.
That was funny.
Yeah, that was funny. And he had actually long hair. So his hair was growing. And he's like, I think he's 50 or whatever, but he's like, hey, I want to keep my hair. So,
Well, we just see such a better result with topical versus the oral, because when you're rubbing it in, it's going down the drain, down the pore, and it's protecting the seeds directly.
Okay.
And that's where that DHT is attacking. So DHT is found in 2 places. It's found circulating along where the seed is, and it's also in our bloodstream. So we don't really care too much about the bloodstream DHT. I care about the DHT that's attacking right around the hair. So when you take something orally, it's going to actually lower the DHT more in the bloodstream than right at the hair seed level. It's more systemic.
That's pretty interesting.
So DHT levels don't matter to me. You and I could both have high DHT levels and no problem, and someone comes in and has a very low DHT level and has more of a problem. It's more the sensitivity than it is the actual number. So I try to focus, let's work on lowering the DHT where it counts, which is at the hair seeds. That's why the topical has been proven to be better.
Interesting.
Yeah.
So like in your practice, so is it predominantly men? Or
It is predominantly men. I'd say clinic-wise, 75% is male.
Okay.
And I believe the reason why the female side is so low is because either they go straight to Minoxidil at the grocery store, or they usually go to their primary care provider who tells them to go to the grocery store to get Minoxidil.
Yeah.
So it's some people, I think that it's more either the referrals, such as yourself, or people that are just sick and tired of going the Minoxidil route. They're not seeing the changes, and they're ready to see a specialist.
Yeah, they would go to, some of my girlfriends went to dermatologists.
Yeah.
And they said,
They say the same thing.
Minoxidil. And
Yeah.
what's the difference between 2% Minoxidil and 5%? Because I know that there's like women's, like it's marketed to women,
That's right.
Minoxidil, and the men. What's the difference?
So back in the day, the 2% was for women and the 5% was for men.
Right.
But several smart dermatologists were still offering and recommending the 5% to women.
Yeah.
In 2016 or 17, the FDA approved the 5% for women.
Okay.
So you really should just be taking the 5%.
Yeah, because there are women out there saying, I would take 5%.
Yeah.
So 'cause back in my, obviously, discovering what I should take to grow my hair, that was the main thing.
Yeah.
They were like, oh, watch out, do 2%. And then other people would say 5%. So it was really confusing, but that's good to know. If you are using minoxidil, 5% is okay.
Yeah.
But you should be on Hair Lab number 2.
Well, a big complaint aside from purchasing the over-the-counter minoxidil or Rogaine is the liquid forms of minoxidil and Rogaine. They have an ingredient in there called propylene glycol. And what that is it's a sister compound of antifreeze. The reason why is these manufacturers are making thousands upon thousands of bottles. And when they're distributing them to pharmacies and grocery stores, it's bad for their business if they dry out.
Right.
So the antifreeze compound, propylene glycol, is actually keeping it as a liquid. Unfortunately, that is the #1 cause for skin sensitivity. So itching, redness, exacerbation of dandruff, those are things that can happen because of that. And so again, it's going to lead to non-compliance.
Okay, so Hair Lab #2 does not have that.
It's preservative free. It actually will have an expiration date. It's no different than your milk in your fridge because we don't want any preservatives to create any sort of skin sensitivity.
Yes, I learned it. They said take it because is it 90 days or 30 days? I can't remember.
So you'll get a 90-day supply.
Right.
And then you'll get, there's an expiration date. And then slowly after that date, the main ingredients will slowly degrade.
Gotcha.
And they just won't be effective. And eventually they actually just don't do anything at all.
So you got to use it.
You got to use it. You got to use it. Exactly.
So how often would they use something like this?
So medicine is medicine. It's got to be taken every day.
Okay.
If you stop taking your thyroid medicine or you're inconsistent with it, you can't expect to have a normal thyroid level. So this medicine will leave the body every 22 hours or so. So it's important to be consistent, no different again than brushing our teeth. This is essentially a toothbrush for your hair. You've got to be consistent. If you can have the mentality that it's part of your lifestyle
Right.
and not a chore,
Right.
and it's something that you just will always remember doing, no different than us washing our face or brushing our teeth, then it just becomes part of your daily routine. It really takes, in my opinion, 10 to 15 seconds to do it.
Yeah.
First week or two, you'll fumble, but once you're doing your 3 rows, over, a vertical row over your left eye,
Yeah.
vertical row over in between your eyes, and then over the right eye, you'll rub it in. You'll be done in such a quick time. It takes longer to brush your teeth than to actually put this.
It really does.
Yeah.
I do it at night. I actually have it next
Yeah.
to my toothbrush at night. Boom, you're
Yeah.
done. Yeah, literally, it's like a lifesaver.
Yeah.
For sure. And then, you were talking about the shelf life of this. So you do this at night.
Mhm.
What if you skip a day or two? What happens?
Nothing's going to happen if you skip a day or two. Same
Okay.
thing with most common medicines. What happens is if you took it Monday through Thursday and then you had a long weekend and
Yeah.
then you forgot it, or you decided to go out of town and you forgot to put it in your gob kit, you just don't want that inconsistency.
Okay.
And we do have some people that swear that if they go more than 2 or 3 days without using it, they'll start to see some hair shedding. And I'm not saying
Yeah.
that's untrue. Typically, you'll
True.
need a little bit more time for
Right.
it to start causing that effect. But you don't use it, you lose it. It cannot
Yeah.
keep what you're doing or keep the improvements that you're gaining or maintaining what you still have if you stop using it.
Yeah.
No different again than any other medicine.
No, that makes sense.
Yeah.
So what if you completely get off? What happens?
So if you completely get off within a few months, you're going to go back to where you were before we met. There's this common misconception that if I get off this medicine, I get worse. No, it's because every day is a new baseline. You forgot that you used to look this certain way. And now we've rethickened you. And now the
Yeah.
medicine's out of your system.
Right.
So your body your hair has a destiny. And if we are stopping and preventing that destiny from happening, and now the medicine is not in your system, it's going to go back to where you were before we started. And then there's no telling what's going to happen after. So people go, well, I got way worse because I shed like crazy. Yeah, it's because we were preventing you from losing more hair for as long as you were on it. It's no different than if you were on, let's say, testosterone for low T,
Right.
and you go, wow, I feel unbelievable. And now you're off and you go, man, why do I feel bad again?
Yeah.
It's not in your body able to help you, which is the whole reason why you got on in the first place. So this is a lifelong thing, no different than any other things that we have to do lifelong for prevention and treatment.
I completely get it.
Yeah.
I'm doing this all the time. Like even when I travel, I'm like
Yeah.
worried. Yeah.
Until
So-
something else comes around.
Yes, until something else
Right.
comes around for
Yeah.
sure. So where can they get these products at?
So products do not require prescription. You can go on our website and order them directly. That does not require a doctor visit, or you can always call the office and we'll assist you. This does require a doctor's visit, whether it's in person or telemedicine, just because we have to have a physical examination and a chart for each patient in order to order
I
this.
know the health history of your hair.
I need to know everything exactly.
Yeah,
As
yeah.
you can see, it's quite complex.
It is.
Yeah.
It is. So yeah, definitely. Like when I had to fill out that questionnaire,
It's complex.
it's
Yeah.
complex. They want to know everything that you're on
Yeah.
because they really want to get down to why are you losing your hair, right?
I always actually look at the patient's chart prior to meeting the person. So I'm
Right.
already painting the picture in my head. what I need to check for, what I need to ask for. I don't just look 2 minutes before when the patient arrives.
Gotcha.
I'm actually doing my
Yes.
homework because that's what you guys deserve.
So tell us walk us through, even though I've already been through it, a typical consultation.
Sure. So please be on time.
Yeah.
No, I'm just kidding.
I love that. Yes.
We'll see you first. We'll go over your information. As I said, I kind of already have an idea in my head, but I want to get maybe a little bit more details that are not being asked on the forms itself. Then I'll do the examination. I will show you with the microscope what your hair and skin looks like. And then I'll sit down and I do an educational part. So I will explain what I believe is your number one cause, what are potentially some external factors, how we can help you with those. And then we'll get into the weeds with the proper treatment plan.
Okay. Yeah. And then, of course, they can reach you at Dr. Yaker. Is it
YakerMD.
YakerMD.
Dr. Yaker will be my father.
Okay.
He doesn't do hair. He does other good stuff, but doesn't do hair.
Okay. YakerMD.com is a SIPA consultation. And then you could also reach out on the website. You can go ahead and get the shampoo, conditioner, Menoplex. And I think that's it for today.
Yeah. And stay tuned. We're making a new shampoo and conditioner.
Ooh.
I just finalized the formulation, so we should have it hopefully once we figure out the bottling. And then we're making an Menoplex version 2.0.
Okay.
That'll be in 2 months. And I'm making a multivitamin as well.
Nice.
Yeah.
I love new and improved things.
That's right. We'll get them to you.
Yeah. All about hair health. So.
That's right.
All right. Well, thank you for joining us today. And if you have any questions, just put them on the comments below. I'll answer them later. And check it out at YakerMD.com. And I'll see you guys later.
Thanks.
Bye, guys.
Bye.